Okay. Welcome everybody to the first meeting of 2021 of the Virginia Caregiver Coalition. I want to just thank you all for being here. I'd like to start off doing a little networking exercise here. I'd like to go around the room and the virtual room and have everybody introduce themselves. Lauren, you and Kim can hold off because I'm going to introduce you down the line. But Connie, you're a first timer here, so tell us a little bit about yourself.
Well, hello, I'm from Roanoke, Virginia. I'm a community ambassador for AARP. Very interested in caregiving. I took care of my parents for 8.5 years and survived that by the grace of God, but very, very hard. I'm really interested in helping people find the resources they need, because at that time I didn't know of additional resources that I could use that would have helped me, and it was a very lonely time. So I'm on a mission to help those caregivers say, hey, here's some information that may help, and be support for folks like that. So that's where my interest is.
Okay, thank you. Dee, tell us a little bit about yourself and what you've been doing.
Good morning, everybody. My name is Dee Carrots, and I work for Senior Connections, the area agency on aging. And in my role there, I do caregiver support. So I provide education and resources to folks within our area, and hopefully reach out statewide to let others know what other resources there are available to them. I'm also a personal caregiver for my mother.
Donna?
I'm with the Brain Injury Services Coordination Unit at DARS, Department for Aging and Rehabilitative Services. We do a lot of work with caregivers and a caregiver forum every year, and a lot of support groups and stuff like that with some of our community partners. And I have been a caregiver for an aunt with Parkinson's disease, for much of last year.
Joyce?
Good morning, Joyce Nussbaum with Valley Program for Aging Services. I'm the Community Wellness Coordinator and major focus on caregiver support in the past year. Also have had many, many years of caregiver experience personally in a lot of different ways. And so it's good to bring that experience to my work. Thank you.
Thanks. Hi, who's next? Well, skip to Paul. You're muted, Paul, but welcome. It's good to have you with us.
Howdy. Good to see you, Chris, and Nick, and everybody else.
Good. Sarah, one of the rising stars in the care world here. How are you?
I'm doing well. Good to see everyone this morning. My name is Sarah Amos, and I work for Cornerstone Baptist Church. I'm the program director for our caregiver ministry, Cornerstone Care. So we bring a lot of educational and informal support to caregivers in our community.
Lots of programming. Laurie, you there? Okay. Sharon DeBeauvert.
Hi, I'm Sharon DeBeauvert. I am a licensing inspector with the Virginia Department of Social Services. I also do community training for Alzheimer's and dementia. And hi, Paul. And I have 2 support groups that I work with in the area at different times during the month. So that's me.
Okay. Nikisha? You're muted, just in case you didn't know. My mic doesn't work, she says. Okay, well, thanks for joining us. Monica, how about you?
Hi, good morning, everybody. My name is Monica Schroen, and I'm a licensed clinical social worker for the Department of Veterans Services, and I work in our caregiver support program.
Thanks, great work. Let's see, Laurie, are you there? Laurie, you're muted, so. Okay. Krista, how have things been going at Navigator?
Good morning. They're going well. I am Krista Rutherford with Virginia Navigator, as is one of our guest speakers today. So I'll probably let her explain a little bit more, but things are going well. We are still working virtually. I am lucky enough to get to go into the office a few times a week just to hold the fort down there. But we are doing well, working on lots of different projects right now for caregivers, seniors, individuals with any kind of disability, and veterans. So doing good.
Okay, thank you. Teresa, what you been up to?
Hi, I'm Teresa Sweeney. I work here at Riverside Center for Excellence in Aging as an outpatient dementia care coordinator. Christy Jensen, who brought the Dementia Wellness Initiative and the BRI program. So I work with that program.
Okay, great. Well, we're going to talk a little bit about the AARP scorecard today, and I really appreciate if you jump in on that because Christy brought that to our attention, and we're looking to try to get some consensus around how to move forward with perhaps supporting the effort to raise Virginia from the bottom of the pile when it comes to caregiver. And okay, Rebecca, what you been up to?
Hi, I'm Rebecca Fleming. I'm not sure if you were speaking to the other Rebecca.
No, I'm talking to you.
Hi, it's nice to meet you this morning.
Yeah.
I'm the administrative assistant with the Disability Resource Center in Fredericksburg, Virginia. And I recently joined this organization about 4 months ago. And we are working, obviously, with our office still closed due to COVID. So we're doing a lot of virtual meetings and still trying to stay active within the community.
Well, thank you for joining us. It's great. All right, let's see. Who have I not gotten? Sandra, tell us how you've been doing.
I'm doing fine. My name is Sandra Wilson. I work at the Area Agency for Aging in Woodbridge, Virginia for Prince William County Gov.
Well, thanks for joining us. Veronica?
Yes, good morning. My name is Veronica Murray. I'm a licensed clinical social worker at Huntington Home McGuire VA Hospital. I work with the COACH program, caring for older adults and caregivers. I work primarily with the caregivers, caring for veterans diagnosed with Alzheimer's and dementia.
What a great program. Love to hear more about that at some point. If you want to do a brief presentation about what your activities are, just let Nick know and we'll put you on the schedule for an upcoming meeting.
Thank you.
Let's see. Ellen, how are you? Welcome. Thanks for coming.
Hi, it's good to be here. Ignore my email. I had a little problems joining, but I'm here. I'm Ellen
Oh my
Phibbs.
God, it's Ellen Phibbs. Hello. Sorry.
Sharon, hi. Well, this is very nice. Good to see everybody. I'm Ellen Phibbs. I'm the Executive Director of Aging Together, serving Planning District 9, the counties of Culpeper, Madison, Fauquier, Rappahannock, and I think in Orange, yes, left one out, in Orange counties in Virginia. And we are really about connecting people, caregivers, and older adults to needed resources and information in our area. We work very closely with the Area Agency on Aging in sort of filling in gaps where there's gaps in services. So it's good to be here.
Great. Okay. Let's see. Who hasn't gone yet? Looking at Laurie, were you able to say hello? All right. You're muted. So.
Lori's having mic problems according to chat.
Oh,
and there's another
okay.
introduction That's it.
Ah, I see. Okay. All righty. Liza, oh, I'm sorry, Violetta, welcome. Good to hear. I'm so glad you're here. Tell us about yourself and what you've been up to.
Good morning, everybody. I hope you can hear me. I'm having some technical issues as well. But I am a mental health counselor providing community-based behavioral health services as an independent contractor. And I am also a personal caregiver for my mom, who is going to be 97 in April.
Well, she's got a great caregiver, that's for sure.
Thank you.
Liza, what you been up to?
Hi, Chris. And hello, everyone. My name is Liza White. Oh, I forget that that's on there. I am the Virginia Lifespan Respite Grant Voucher Coordinator for the Department for Aging and Rehabilitative Services. And I'm happy to see everyone today.
Well, congratulations, and you're taking over a terrific program.
Yes, I am. I love it here already.
We got big shoes to fill. Nick has just been a wonderful shepherd of the program.
I know. I don't think I could outdo Nick, but I'll try my best.
Dimitri, are you there?
Hi.
Hi.
I am working with the Disability Resource Center. They are trying to help us establish a center for independent living here in the lower part of PD9. And I'm trying to do some outreach to help make that a reality over the next couple of years. I'm a person with a lived experience as a person with a disability. So I had great supporters, and I still do, who have helped me come back from a brain aneurysm and living with epilepsy and other impacts from acquired brain injury, and living here in Culpeper. I have a full-time job also with the Workforce Center. And so I'm trying to get my feet under me. So I'm joining lots of groups. So I'm getting to know different people in the community who are part of different groups. So some of the people I have met who are on this call, but lots of you I haven't met yet. So I'm hoping to meet people who would like to be a part of a grassroots movement of establishing a center for independent living. And it needs to be a mix of people with the lived experience of living with a disability, but also people who I like to call supporters, who have been traditionally called caregivers, but I like to call them supporters, because as a person who is now almost 55 years old, living with a disability, I like to think of the people who take care of me as my supporters, because it's hard for me to think of them as my caregivers when I'm 54 years old. But yeah, at different times they have been my caregivers. So thank you for inviting me to this call, and I'm looking forward to learning a lot. Thank you.
Thank you. And I guess we should be looking into changing our name to the Supporters Coalition. So, Moretta, how have you been? Happy New Year.
Hi, everyone. Happy New Year. Well, yeah, I'm Moretta Copeland. I work with VCU Partnership for People with Disabilities, very part-time. I'm also the mom to 2 young adult children, one who does have a developmental disability, and I am one of her support people. Anyway, it is good to see everyone. I hope that everyone is doing well with COVID and everything else going on.
Thanks, Moretta. Also, by the way, everybody, if you have people who are interested in joining the coalition, Moretta's your person. She is our membership director. And if you're interested in doing outreach for the coalition, she's the person to talk to. She's got a great team and yeah, really vital part of the whole organization. So Moretta, thank you. And I'm wishing you a happy 2021.
Thank you.
George, how are you doing?
Morning, folks. I'm George Worthington. I'm the Dementia Services Coordinator with the Department for Aging and Rehabilitative Services. Happy New Year, everybody. Great to see so many folks here.
That's great. All right, anybody I missed? I know some people are having some mic problems. Rebecca, welcome. Glad you're here. Laurie, glad you're here. Did I miss anybody? Veronica?
Yeah, I did speak.
You did. Good. Okay. I'm trying to keep, this is the fun thing about Zoom is, trying to keep organized around the table, and the boxes keep moving. It's like Hollywood squares on steroids here. So, all right. Well, thank you, everybody. Thanks for coming. I just want a couple of news items here that you should know about. Insight Memory Care Center is offering classes for caregivers. They've got a Wednesday class series, and they're offering some terrific subjects starting in February, on February 10th. So it's every Wednesday each month. So for instance, in February, they're doing normal aging versus dementia. And then in March, they're going to do the dementias once on the treatment horizon. And so I just encourage you to go to the Insight Memory Care Center and look for classes for caregivers. Some terrific resources there, good programming that you and your stakeholders might be interested in. The sessions are open to the public. To register, just visit the insightmcc.org/events. I'm sure they've got something on the homepage to guide you there. And the classes are geared towards family caregivers caring for a loved one at home or friends and family. All classes obviously will be held virtually. So, before we get too far away, I want to welcome two new members. I don't see them on the call today, but hopefully they'll join us in the future. Catherine Sue, S-U-H, I think is that the pronunciation? Does anybody know Catherine? Okay. And also Simone Rouse from Creative Vacations. She is interested in joining several of the committees. So hopefully, Moretta, you can reach out to Simone at some point and see how she's doing and encourage her to join us. All right. Let's see. I got an interesting note here. There was a webinar on the RAISE Act. Now, this is pretty, in the weeds administrative stuff, but there was a webinar on the RAISE Act, state policies, and the NASHP State Medicaid Policy Institute on Family Caregiving. This was a webinar that was held on January 13th, but the slides are available if you want to take a peek at those. They've got some recommendations for better family support for caregivers. And the key thing is information from Carrie Mulk, who is the director of the Wisconsin Bureau of Aging and Disability Resources and a real leader in caregiver advocacy nationally. So yeah, so if you're interested in that, the slides for that webinar are available. And if you're interested, just give Nick a call. He can shoot you the link to those slides, the download.
I will also be sending them out in the meeting minutes afterwards, along with
recording of this meeting.
Good. On top of it. All right, let's see. One thing I wanted to discuss, we had our executive committee meeting last month, and for 2020, our coalition project was the Virginia Caregivers Guide, and that is in process and ready to go. And I thank all of you who participated in the session to discuss, disassemble, reconstruct that document. And hopefully we will have that out and starting to get into people's hands very soon. It goes on top of some very fine, more regional caregiver guides, resource guides that, for instance, Ellen has put together with Aging Together. And of course, Navigator is just, the gold standard for resources. But we are trying to put together, we did put together a treeware version of a compendium of resources for those that are not adept at working online. So what we're doing is looking for a coalition project for this year, and one of the items that were brought to our attention is the AARP scorecard. And this, currently I can just say briefly that Virginia ranks very, very low on nationally on caregiver services. And so the idea was for the coalition to be an agent in trying to work with the people that make up this score to find out what areas are important to score highly on, and what we can do as a group and as a state to begin to raise Virginia's score on this and on the AARP scorecard for care. So I'd like your ideas if anybody wants to look at that. Let's see, Connie, is there an AARP scorecard link that you could send along to Nick and he would send it out in the minutes?
I am not aware of that, but I will certainly find out and take care of it.
All right, thank you so much. Yeah, Christy Jensen brought it to our attention, and I think it's a worthy thing for consideration. It might be a great project for us to work together on. And so I'll leave it up to you, but if anybody's interested in helping to put together a work group, please contact me or Nick, and we'll take it from there. We'll try to put together and see if that can be our mission for the year, is to begin to raise Virginia's score on that AARP scorecard. All right, so without further ado.
Sorry, Chris.
Yes.
This is George.
Hi, George.
Could I just add something to that?
Yes, please.
So Christy Jensen and I had a conversation with the national methodology folks who look after the scorecard late last year, and Christy and Donna and I are trying to work out an opportunity for Christy and perhaps those folks to come and give us the background to the long-term care scorecard. And then I think from that, with that information, we'll be able to hopefully run with that. So
yes.
Trying to get Christy in March, but we'll see how that goes.
Okay, great. Thanks, George. That's terrific. Yeah, that's a follow-on to the meeting we had in the middle of the month. So that's great to hear. All right. Does anybody else have any items of interest that you'd like to present for us here to the meeting? if something comes up, you can always put it in the chat box, and we will also the link to the NASHP webinar is on the chat box, so you can cut and paste that, I guess, or click
Chris,
right. Yes. Yes.
With my limited knowledge of what we're doing or looking to do with the scorecard, what is the coalition's goal as far as the AARP scorecard goes?
Well, the idea is to, since we are a coalition of caregiver organizations and caregivers, you know, we have access to people around the state. And so the idea would be to help advocate for policies that might help raise that score. But again, we're in the beginning phases of that. And as George said, we're going to try to find out what the metrics are and what we have to address in order to improve those scores. Okay, anybody else?
One of my questions is what are the metrics? We'll find that out.
Yeah.
Thank you.
Sure, you're welcome. Anybody else before we get going? All right. All right, right on time. Our speakers today are Lauren Ruiz and Kim Tarantino. And Lauren has worked in nonprofit patient support for over a decade with a focus on understanding, increasing access to, and effective utilization of private and public health insurance systems. She's worked with a wide range of communities and successfully managed teams of patient advocates to provide direct patient support services to individuals living with complex chronic diseases and their families all across the US. She believes strongly in the mutually beneficial relationship between patient and patient advocate, whatever form that may take. She attended Virginia Tech, go Hokies, receiving degrees in political science and mass communications with a focus on English writing. Kim Tarantino has been part of the Virginia Navigator team for over 17 years. 17 years? You started when you were 5? What? Okay. And she's held a variety of positions within the organization. She currently serves as deputy director, where she oversees all programs, including data, content, marketing, special projects, and administration. Additionally, Kim serves as a special project lead for Virginia Navigator's Lindsay Institute for Innovations in Caregiving. She is passionate about supporting caregivers and ensuring that while they care for their loved ones, they care for themselves. Kim graduated with honors from Mary Baldwin College with a degree in communications. So it's my great pleasure to turn the meeting over to you two, and thank you so much for being with us today and presenting this.
Thank you so much, Chris.
I'm going to go ahead and share my screen real quick, and then Kim will kick us off.
Great. And we'll hope, yay. All right, so can I get some thumbs up? Everybody can see the screen share?
Yes.
Okay, great.
Large, we need to, there we go. We need to scale it down just a bit.
And can you see it move when I change the slide?
Yes.
I can. Oh. All right, great. Thanks, Lauren. And thank you all so much for having Lauren and I today. We are pleased to be able to share with you some work we've been partnering on over the last months. Really excited to just share some of the thought process and what we've been working on, and then also how we are envisioning the Caregiver Coalition and being part and taking part of some of this work. So with that, next slide, Lauren. So I guess it was late 2019, some Virginia Navigator staff members met Lauren and Greg Smiley, who is the founder and CEO of the Adira Foundation. And in meeting and just learning more about each other's organizations, we really found that people living with a neurodegenerative disease, as well as their care partners, don't always have the access to services and supports that they need. You know, that's one of our goals at Virginia Navigator, is to be able to connect people with those programs and services that they need. But we found that there was a gap here and a real need. And so we, in 2020, Virginia Navigator and Adira Foundation formally entered into a partnership where we've been working over the last few months with the goal of really empowering Virginians that are impacted by neurodegenerative diseases by connecting them with comprehensive information on those programs and services that are specifically designed for them, those very niche kind of programs and services, as well as just even more broad programs and services as well. And so we at Virginia Navigator have a fantastic data team that is focused on making sure that we have a breadth of programs and services available in our resource directory. And so we've been working kind of on that lens of things within Virginia Navigator, and I'll share a little bit about that in just a moment. And also from the Adira side, they have a fantastic mapping project that really seeks to create a visual that shows where communities may have resources specific to neurodegenerative diseases, and that can really help in a very visual way identify any gaps in those services. And Lauren will show you more of that in just a few minutes. So just to take, I know there's a few new folks on the call. Some of you I've had the opportunity to work with over a number of years, and there's some new faces. So great to see those of you whom I've met, and thrilled to be able to also connect with those of you who are new on the call today. Just a few quick points about Virginia Navigator if you are not familiar. We are a nonprofit organization that serves the entire state of Virginia. We were founded in 2001 and will actually be celebrating our 20th year anniversary in February. So super proud of that milestone. We have a family of websites that really provides free information and guidance to older adults, people with disabilities, veterans, and their care partners and families via a high-tech, high-touch approach. And our high-tech approach really is through our family of websites that you'll see listed here: Disability Navigator, Senior Navigator, Veterans Navigator, and then kind of the overarching Virginia Navigator umbrella. And as part of those family of websites, we offer more than 26,000 program and service listings so that folks can be empowered and connect with the critical services that they might need. In addition to the programs and services, we have thousands of educational articles, an Ask an Expert feature, a community calendar, a service navigator sort of needs assessment tool for folks that just really have no idea what they really need, but they know they need something. So really try to be kind of a one-stop shop for all of these areas. Next slide. Resources are really varied, including everything from caregiver support to in-home care, transportation, rehabilitation, and thousands more. As I mentioned, we have over 26,000 programs and services currently in our resource directory that are searchable by city, county, or zip code within the state of Virginia.
Thanks so much, Kim, for that introduction and overview of Virginia Navigator. I encourage any new members, any new individuals on the call to check out all of their websites. I'm sure that you'll be very impressed with the work that they've done for the community so far. Similarly, Adira Foundation is probably new to most people on this call, so I'll take just a moment to introduce you to our organization and some of the work that we're doing. We are a national 501c3 public foundation. We were founded in 2019. Our headquarters are in Richmond, Virginia, but we serve a national population of individuals living with a neurodegenerative disease and the care partners who support them. Our founder and CEO, as Kim mentioned, Greg Smiley is himself the survivor of a multi-trauma accident and knows firsthand the challenges of navigating multiple needs. When he was stationed in South Africa, he was in a very serious bicycling accident and has had about 12 reconstructive surgeries to his face, nose, and chin, and currently still deals with some of those symptoms related to traumatic brain injury, speech, swallowing, things like that. And despite having so many resources himself, that journey was very, very difficult and overwhelming for him. And so he really, in founding Adira Foundation, wanted to make sure that we were focusing on programs and organizations that would really help to ease that burden on people living with complex conditions. Our mission is to invest in better lives for people with neurodegenerative diseases, and we're supported in that effort by a board of directors who are all accomplished experts who have cared for someone themselves or devoted their careers to those providing care to others. Specifically within the neurodegenerative disease community, we focus on 5 populations. This includes Alzheimer's disease, ALS or amyotrophic lateral sclerosis, Huntington's disease, multiple sclerosis, and Parkinson's disease. While these diseases are very different, the barriers that they may run into throughout their disease journey over time are very similar. And there's a lot in common that individuals living with one of these diagnoses or caring for someone living with one of these diagnoses have. And so we fund organizations that serve people within these populations and act as a neutral platform to help advance conversations on improving care. We feel that a rising tide lifts all boats, and that's really the approach that we try to take within the ND communities. And specifically, we do that through a listen, learn, act model. So Kim will talk a little bit more later about some of the person-centered care activities that we are using in our approach to this project. But that really is one of the main reasons why we want to talk to you all today about the project that we have regarding network mapping and resource directory. The next big stage of our project is really getting more input from the community and being able to incorporate that community voice into the project so that we can ensure that what we're delivering will actually meet their needs the best and in the way that is preferred. So those are our goals here with that project. In addition to our kind of normal rounds of granting that you may expect from a foundation, we also delve into demonstration projects here and there. And that's what we're doing with Virginia Navigator through our network mapping project. With our demonstration projects, we always try to focus on 3 things. Navigation, this is simplifying and streamlining how people access the best services for them. So for us, that really means personalized service or the ability to easily search and navigate to the resources that are going to best fit those needs. Aggregation is simply bringing communities together. So for us, that means implementing programs and services that can serve 2 or more of those 5 diagnoses that I mentioned previously. And convening just comes back to that idea of person-centered design. We hope that all of our projects and all of our activities are led by people most impacted by these diagnoses, the people living with the disease and their care partners that support them. So we do hope to design opportunities for those individuals to come together and always have input and influence on the work that we're doing. So because this is such a new technology and something that we are really trying to introduce not only to the patient and caregiver community within the ND network, but also professionals as well, and those people that provide navigation support to those in need. So Adira Foundation started by creating a basic neurodegenerative disease network map. Here, we simply identified all of the organizations across the US that have a specific focus or their mission includes the intent to help and support people with one or more of these 5 diseases. In the basic network map, before I pull it up and show you guys, I do just want to give one little disclaimer about the organizations that are included in this. Again, as I mentioned, the organizations included here have a specific mission or focus on supporting these diagnoses. We understand that there are a plethora of organizations that do support these communities and will not be included in this map. And that's because they have a kind of a larger goal or a larger focus. It's not just on these communities. In the network mapping universe, we refer to those types of organizations as boundary spanners. And we hope in the future to be able to expand and enhance the mapping project to better include those organizations. But as we begin this project, and you'll see how much resource and expertise Virginia Navigator is lending to us to really build this next prototype, that's something that we want to grow into. So when we established the basic network map, we were able to identify about 1,500 organizations nationwide that have a specific focus on working with one or more of these 5 targeted ND groups. As Kim said, what we really want to do here is to be able to provide a visual. The basic network map is really meant more for that high level analysis of resources that exist for this community. So right away, you can see that each kind of separate area is one of our 5 disease states. This one, I can zoom in, being for multiple sclerosis.
Hey, Lauren, we're not able to see, I think, what you're seeing on the screen.
Now, can you see it?
No.
Is it just like a white screen?
No, at least what I'm seeing is the PowerPoint slide from probably before you went on to the interactive map.
Yeah, I think you have to stop share and reshare.
I will try it.
What I see is the basic network map.
What about
Here we go.
Thank you, Kim, for bringing that up and letting me know. So I'll just pull this out back for a second. So here is the basic network map. And as Kim mentioned, this is really for that high level visual of being able to explore resources that exist within these communities. And really for us as a foundation, we want to be able to identify where those gaps in service exist so that we can really focus our efforts on bringing awareness to those issues, convening organizations in coalitions and collective efforts to move the needle on improving those efforts, or putting funding specifically in those areas and funding organizations that specifically help with those key areas that we've identified as having gaps. So the 5 different areas here represent those 5 different populations that we work in. I can zoom in on one for an example. Here we're looking at the universe of multiple sclerosis. Here we're looking at organizations affiliated with Huntington's disease. And any organizations that you would see here in the middle areas would be those that are serving more than one population at a time. So you can kind of see where overlap is between the populations. You can see what types of programs are more likely to be aggregated and a similar service provided to multiple populations. And you can also see for each disease state kind of what their programs lean toward. For example, over here in Alzheimer's disease, you see a lot of these orange bubbles. And in our legend, we see that that's related to clinical research. So there's a lot of clinical research that goes on specific to Alzheimer's disease, and we can see that at this very high level. And you might not see that represented as equally in some of the other populations. So this tool, like I said, is really more for professionals, funders, advocates, policymakers to, again, review what resources exist within these communities, see where dollars and resources are currently being focused and expended, and really identify where those gaps are. We also have the option of overlaying this map in a geographic form so that we can see where these services are centered geographically within the US and help to identify some of those geographic gaps in service as well. The next example that we have for the map is this prototype map that Virginia Navigator is specifically building for us. This is the Virginia Neurodegenerative Disease Patient and Caregiver Support Programs map. So our basic map really just identifies the organization. It gives you the name of the organization and different ways that you can find out more about it. For example, their website, contact, headquarter location, things like that. But for someone who's really trying to access a resource or decide if a resource is a good fit for them, they need a lot more information than that. And this is where Virginia Navigator really lends their expertise and their database organization capabilities to enhance this project. So what we've asked them to do is build a prototype map that takes things a little bit deeper. Instead of just identifying the organization and saying, hey, they work with someone with your similar diagnosis, they're really looking at what are the specific programs and services that they're offering to these communities. The intent here is to provide patients, caregivers, and professionals in Virginia with a tool that will help them to explore that whole universe of ND experts that are available to them and make the best decisions on accessing those services. I'm just going to check with you real quick. Can you guys see a network map again?
Yes, ma'am.
Excellent. So this is that beginning stage of that prototype map, specifically looking at patient and caregiver support programs within Virginia. Again, you can see that there are kind of separate siloed areas. Our disease states are all practicing social distancing right now, and they each kind of have their own space. We do see some organizations clustered in the middle. And again, those are those entities or agencies that are supporting one or two or more of these diseases. What you can actually do within the tool is search through a lot of different ways. And as Kim talks about some of the ways that you all can get involved or encourage your network of patients or caregivers related to these communities to get involved as well, we want to make sure that we are providing a tool where people can search in a lot of different ways, and they can search in the ways that make the most sense to them. So we have up here a very simple search option where if someone is just kind of in general wanting to explore or find more resources on a certain topic, they can just click up here for what they're looking for. So maybe I want to find a disease forum where I can actually talk and connect with peers or others with lived experience similar to mine. I can simply click on that, and it shows all of the disease forums that have forums specifically for people with these diagnoses. If I want to do a more specific search, I can come over into the search bar and start typing in whatever it is that I might need help with. If I start typing in ALS, it starts bringing up all of those organizations here. This, like I said, is kind of the beginning of the prototype. We took from our basic network map all of the organizations within the US that are either located in Virginia or specifically offer services to Virginia residents. And we provided that list to Virginia Navigator. And now Kim is going to talk a little bit more about some of the specific activities that they're doing within this project for us to really help bring this map to life and fill in all of the specific detailed information about the organization that someone would want to learn. So here on the profile card for this organization, you can see right now that it's still pretty basic. We have things like the name, the type of service that it provides, where it's located, their website, when it was founded, the scope of their service, who their funding sources are. Is it a nonprofit? Is it a private company? If they are affiliated with a specific neurodegenerative disease, and any connections to other organizations in the network that they may have. So that information will become more accurate, more complete, and more robust as Virginia Navigator continues to work on this project for us. I'm going to enter back into our slideshow. And then I'm going to kick it over to Kim, like I said, where she's going to talk in more detail how they're taking that prototype map and really enhancing that in many different ways for us so that this will be a tool of great use to the community.
Great, thanks, Lauren. I always get so excited when I see that map and all the movement and all the colors. It's just, it's so amazing. And we're so thrilled to be part of this. So I've gotten a couple questions sent to me in the chat. So let me just put out there, a couple people have asked, where is this information? How can we access it on Virginia Navigator? It's not there yet. This is a project that we're still working on. It's still in process. I'll share a little bit more about that, but I just wanted to get that out since there have been some questions about it in case anyone else was wondering. Next slide, Lauren, please. So Lauren just showed you the example of the Virginia prototype map, and she pulled up a profile card of one of the organizations that's included within the map. And so really Virginia Navigator, as you all know that are familiar with our organization, we really work very hard. Our data team just does a phenomenal job of including a wealth of information on each organization and each organization's programs. So organization-wise, you can see here the type of information that we include, name, a description of the organization, the service area that they may serve, if it's the whole state, if it's a segment of it, any social media types of information, certifications, so on and so forth. But each organization generally has multiple programs that they offer. And so we're working on making sure that we are including all of the organizations that serve these populations, as well as all of the different programs that they offer to serve the populations. And so on those profile cards, it will be everything from, who to contact. So you actually have perhaps a person's name that you can contact, any eligibility requirements, Languages spoken, that's a big one. Service delivery method, is this something that's in home, on site? Can it be sort of a tele option? Hours of operation, accessibility info, just really a wealth of information so that when an individual is searching for programs and services, they are empowered to be able to find those programs that are the best match for them or their loved one that they might be helping to support. And so they really get a comprehensive look at all the organizations as well as those specific programs that can help support them. And so that really kind of helps with the decision-making process. We want to make sure, I know Lauren mentioned that the term person-centered, that's something that I know I'm hearing much more about in recent years. And we are, both organizations, Virginia Navigator and the Adira Foundation, are incredibly committed to making this work and all that we do really person-centric and person-centered. And so we want to make sure that when folks are seeking services, that they can do so in an easy way that works for them. And so, for example, one of the things that we're doing, our data team is working on, and it's been a long process, as I'm sure you can appreciate, but we have to date added over 12,000 unique search terms just for these neurodegenerative diseases, so that if someone accidentally misspells it, because some of these terms are complex and easy to misspell. So we want to make sure that if someone is accidentally misspelled something, they're still going to be presented with those programs and services and information that they would have expected. And also a professional in the field may refer to something differently than, say, a consumer would. They may type in a different search term. And so we want to make sure that we've captured everything that professionals or consumers alike might need in order to get those programs and services. Through the visual interactive map, as Lauren showed you, there's really that broad search where at the top she was able to select, Alzheimer's disease or Parkinson's, and then it, filters it down from there. Specific filters for a more focused search, and then that real specific search for an organization in the search bar that she showed you, where it brought back the listing of the organizations that match that criteria. And so this person-centered design really at the forefront of our thinking. Right now, we're in the process of getting a bunch of programs and services added that we know need to be added, that we know we don't have in our resource directory, and that we know people need to be connected to. That's a real focus of ours at this time. And we've got much experience in that realm, just holistically with our Virginia Navigator family of websites. We're obviously focusing now on making sure that we have those programs and services that will help support the neurodegenerative disease community. But we also want to make sure that we are hearing from what I'll call the folks, the really kind of boots on the ground, the people that are in the community that are going to be using these programs and services, the people like yourselves working with folks in the community, care partners. We want to hear from people living with Alzheimer's and Parkinson's and MS, all these neurodegenerative diseases, to make sure that what we're working on and what we're building is really going to support them. And so we are combining what we're calling a pre-survey, a survey that's going to be brief, not anything crazy, but just to make sure we are heading down the right track. And some of what we learn and the information that we find out from that survey is actually going to help formulate what we're calling a convening. Originally, before COVID, the idea was that we would be having conversations with people in person, one-on-one, maybe in small group type settings. Obviously, COVID has changed the landscape, and we're now going to be hosting a virtual convening where we're bringing together these groups of people here to make sure that we are best fulfilling the needs that they have, and that we're best serving the gaps that they have found, and that we are taking into account all the different ways that they need to access services and what they need to access, and really applying those learnings through this survey and virtual convening to the design, the delivery, and then the evaluation of our project to make sure that we're really fulfilling those needs. And so I mentioned to you that we were not only excited to share this great work with you, but also really to look to the Virginia Caregiver Coalition for your help in getting involved with this and making this project a success. So some of the ways that you can do that as coalition members, next slide, are, if you are a person that's living with a neurodegenerative disease or a care partner to someone that may be living with a neurodegenerative disease, we would love for you to take part in this survey and convening when it's time. Lauren's going to share a little bit more about our timeline with you in just a few moments, but please get involved. Certainly many of you are working with families and working with individuals on a daily basis, and you may know of some specific folks who meet this criteria. Please encourage them to participate. We're designing this for them, and we want to make sure we hear from them. And so, tell them what you've learned today, tell them about this project, and encourage them to sign up. We will be creating, an event flyer, social media, sample social media posts that you can share with folks like that, or in a more global way, share it with your clients, with other professionals with whom you work on social media. We would really welcome and encourage you to do that. And, once we're not quite there yet, but once we've got those pieces established, we'll send them on to Nick and, have it circulate amongst the group so you all can kind of help and be part of those recruitment efforts, and making sure the people that this is intended to help, making sure that they can be part of the process. Thank you, Paul. He says, include me in. Thank you so much. So with that, Lauren, I'm going to kick it over to you for kind of where we are in our timeline and a few other support pieces.
Yeah, that's what we like to see, Paul. Thank you so much. Sometimes all it takes is that first person to step up and open the floodgates of participation. So we would love to have you, and we'll make sure that we get you that information. Similar to supporting the pre-convening and the convening itself, you can take similar actions to support the network map and the enhanced directory, focusing on ND services with Virginia Navigator when that launches. If it is something that is relevant to you as a professional, helping your clients or your other community members to navigate, use it. We would love for your feedback. This is, again, going to be a prototype, and it's something that we're hoping to improve and grow. So submit feedback directly to us, participate in any of the assessment surveys or anything that goes out to evaluate that project, and really make sure that your voice and the voice of your clients and your community are being reflected in this tool. Again, send out the link. If you can't use it yourself, you probably know someone who can. I think everyone on this call probably knows someone who knows someone who's impacted by a neurodegenerative disease. So when the tool goes live, even if it's not something that's specifically relevant to you or your experience at this time, I think that it will be relevant to people that you know, and you can always share that with them and give them that opportunity to explore it. And spread that word through your networks or on social media with the link to the tools once they become available. And that will be in June. So as Kim said, we are currently getting ready to announce the convening and to send out those pre-convening surveys and really start recruitment for that. We're hoping to hold that virtual event and get the response back from the pre-convening survey in March. Around that time. And then we are anticipating that the basic neurodegenerative disease network map will launch in coordination with the prototype map developed by Virginia Navigator for the Virginia specific neurodegenerative disease programs and services. for people living with ND and their caregivers. So we'll have the launch of that tool and that announcement, and that's also when we'll begin evaluating and applying any feedback to the iterative improvement of that tool. The last thing that I want to do is just brag on Virginia Navigator a little bit. They're really getting into the weeds with the project now in getting that community buy-in and starting outreach and really putting together the prototype. But I don't want to downplay the work that they've done already. Their data team has just really taken on all of the work and the burden of this project. And so far to date, they've already been able to add an additional 282 programs within the Virginia Navigator resource directory, either creating a new entry in the directory for an organization that was previously unidentified as being able to serve Virginia residents, or updating an existing entry to indicate that specific focus on those ND populations. So we're really excited and know that even just with the work that we've done so far, there's definitely going to be some impact in these communities simply to having access to 282 more programs through the already existing very robust and comprehensive Virginia Navigator resource guide. They've also really helped to improve that resource identification process, adding 50 new program types or program categories that align within their directory. So again, really thinking from all sides and angles about how people are seeking out services. What terms are they using? What are they searching for? And that goes back to that list of synonyms and search terms and misspellings and things that Kim mentioned, really just to enhance that navigation experience. I think she said it was over 12,000 specific terms, and that is included in a 243-page long list, really defining all of those. So that was a huge undertaking and is really just going to make sure that people's experience using this tool is seamless.
Thanks so much, Lauren, and thank you for your kind words. I would be remiss if I did not give a huge shout out to your Caregiver Coalition member, Krista Rutherford, that's also on the call, my colleague. She's been very involved in this project, you know, more from the behind the scenes side and the data side. So Krista, I know you're hearing, thank you for all of your great work, and we really appreciate it. I think you seeing this presentation today and how it's all coming together is great. So you can just sort of understand all this work you're doing every day. It's really, really phenomenal. Also want to just thank you, Lauren, and the Adira Foundation for this partnership and support of this really critically important initiative. We're so thrilled to be a part of it and so thrilled to make sure that we're empowering all Virginians who are living with neurodegenerative diseases and their care partners to be able to find those programs and services that are so critically needed. And also, I want to just take a moment to thank, we heard in the introductions this morning, many of you are caring for loved ones yourselves and supporting loved ones, and just thank you. I know that it's not always the easiest of tasks, but it's such a rewarding one, but it can be a challenge. And I know that COVID has complicated things. So for those of you who are informal and formal caregivers, thank you. Thank you, Caregiver Coalition, for supporting caregivers in the work that you do. We certainly invite you all to use our Virginia Navigator resources to connect with the programs and services that you need. And I will also say one more shout out and thank you that's not on here is thank you for technology that allows us, even in the midst of COVID, to still be together and still to continue to advance amazing work. So hopefully we'll be together soon in person, but until then, I think this is a great option. So thank you, Zoom. And with that, I will turn it back over to you, Chris. We've got our contact information here. If anybody would like to reach out to either Lauren or myself, we'd be happy to answer questions or provide more information. And as I said, we will have the flyer circulated via Nick to the group when we're ready to start advertising the survey and convening. Thank you all so very much.
Thank you, Kim. Thank you, Lauren. That was fantastic. I mean, this is perfect alignment with the coalition's mission, headed by Donna Cantrell, to try to bring our members the most innovative caregiver resources available. And you know, in the past we've had presentations from Ellen Phipps about Aging Together and the great work they're doing. And so I encourage all of you, if you come across resources that you think are unique and should be spread to the membership, please, please, please shoot us an email, and we will try to work it into our education program, or at least work it into a future meeting. So with that, if there are any questions, I know the chat bar has been active. If there are any questions that have not been addressed in the chat bar that you would you'd like to bring to the group before we close up, please do it. Anybody going once, going twice? Okay, well, thank you all for joining us today, and thanks again, Lauren and Kim, for just a terrifically informative presentation. And we will look forward to seeing you in March, I believe. Yes, March, when we have our next general meeting. Again, any comments or information that you come across that you think might be of interest to the group, please shoot Nick an email, and we will try to present it at the next meeting. So if there are no further items, I'm going to move that we adjourn. Do I have a second?
I'll second.
All right. Okay, Paul, thank you, and thanks for joining us, and thanks for your input. You're the person. Okay, thanks everybody.
Thank you, everyone.
Happy New Year,
guys. Thank you so much.
All right.
Thank you very much.
Bye-bye.
Bye-bye.
Thanks so much, Chris. Thanks so much, Nick.
Thank you, Chris and Nick.
Deal.
And Donna.